This is Stephanie Huff, and I'm recording another concept of sensory perception. This one is going to be on cataracts. Just an overview. A cataract is an opacification of or clouding of the lens of the eye, so it looks very opaque. It can it can significantly interfere with light transmission to the retina and the ability to perceive images clearly. It is a common cause of visual deficits, and by the age of 80, half the population has some degree of a cataract. Most of the time, they do not significantly impair vision. Looking at the pathophysiology, not all cataracts need to be removed in the early stages, but many eventually have them surgically corrected. Most form as a result of the aging process. As the lens ages, its fibers and proteins change and degenerate. The proteins then clump together. This causes a clouding of the lens and reducing light transmission to the retina. As the cataract continues to develop, the entire lens may become opaque looking. And so this is a picture showing you a healthy lens versus somebody that has cataracts, what they will actually see. All right, looking at the etiology, the prevalence of cataracts increases rapidly with the aging process. There are 4 types that occur independent of the aging process. The first is secondary, and these can form after surgery to treat another eye disorder like glaucoma, or it could be an effect of medications or another primary disorder. Patients that require regular or recurring doses of steroids are at risk for developing secondary cataracts. Your traumatic cataracts are a result from an injury to the eye. Radiation causes cataracts by long-term exposure of radiation. Your congenital cataracts may appear at childbirth or during childhood, and it usually affects both eyes. And so this is just a picture of a traumatic cataract. And so a lot of times when you're traumatic ones, you have sort of that, sometimes you'll have lines through it like the starburst kind of look, but versus it just being completely opaque and cloudy. Risk factors. Age is the greatest single risk factor for the development of cataracts. Genetics may contribute to the risk, but the link is unclear. Some of your environmental and lifestyle factors, long-term sun exposure, so exposure to UVA and UVB rays increases their risk. Cigarette smoking and heavy alcohol consumption is associated with earlier cataract development. Eye trauma, this includes injury to the lens capsule by a foreign body, also blunt trauma. It can also be from exposure to heat or radiation. Diabetes mellitus, especially when the blood glucose levels are not carefully controlled at a normal or near normal level. Some of your medications, systemic and inhaled corticosteroids, lovastatin, phenytoin, which is your Dilantin, chlorpromazine, which is Thorazine. All of those are related to an increased risk of cataract development. Looking at your clinical manifestations, they tend to occur bilaterally at different rates unless it's related to eye trauma. Usually one cataract generally matures more rapidly than the other. Light rays are scattered as they pass through the lens. This has caused them to complain of a glare. Cataract does interfere with light transmission through the lens. This causes the visual acuity to decrease. It affects both close and distant vision. A lot of times color discrimination is impaired, especially blue to the purple range. They may also have halos, diplopia, which is double vision, or photophobia. Diagnosis is made based on history and eye exam. The ophthalmoscope exam will identify location and extent of the cataract. They will also lose the red reflex, and you will only be able to see a dark area. Looking at the diagnostic test, visual acuity test is used using both the Snellen and the Rosenbaum charts, and we've talked about those before. Snellen is long distance and Rosenbaum is close distance. They will also use a dilated eye exam with either an ophthalmoscope or a slit lamp examination, and that is a picture of a slit lamp. And this views the structures of the eye through magnification process. All right, surgery. Surgical removal of the lens is the only treatment. There is no medical treatment to prevent or treat cataracts. If both eyes are affected, then they will only do one side at a time, and usually whichever one is the worst, they do that one first. Surgery is indicated when vision and activities of daily living are affected, and typically surgery is done on an outpatient basis using only local anesthesia. If they have to end up using general anesthesia, the patient will stay in the hospital overnight. The extracapsular extraction procedure is the procedure of choice. In this, the anterior capsule, nucleus, and cortez of the lens is removed, leaving the posterior capsule intact. After removal of the lens, the eye cannot focus light on the retina and vision is seriously affected. So they insert an intraocular lens, and that is usually plastic, acrylic, or silicone. A secondary procedure called a limbal relaxing incision can be done at the same time as the cataract surgery or at another time, but it helps the client reduce or eliminate the need for glasses after the surgery. And so what they do is they make small incisions to either side of the cornea to allow its shape to be rounder or more symmetrical. Complications are unusual. It's usually less than 1% of the surgeries have a complication. But some of your potential complications are going to be loss of the vitreous humor, corneal edema, increased intraocular pressure, hemorrhage, inflammation, infection, retinal detachment, and displacement of the implanted lens. All right, so this is just kind of the procedure that they will go about in removing the lens and replacing the lens. And so sometimes you see they kind of make an incision on the side and they can pull the lens out, or they can actually break it into clumps and suck those pieces out. And then they will put the new implanted lens into place. And so that's basically it in a nutshell. All right, non-pharmacologic therapy. There are no medications available to treat cataracts. Surgery is not required if a cataract does not interfere with daily living or it's not associated with other eye pathologies. Early cataracts may be managed with magnifying glasses, stronger prescription glasses, brighter lighting, or anti-glare sunglasses. Your complementary and alternative therapies. There is insufficient data to support treatment of cataracts with alternative therapies. Some find acupuncture may relieve symptoms of discomfort, and then some of your CAM healthcare providers, and those are your complementary and alternative therapies, some of those believe that antioxidants improve cataracts because they reduce the amount of free radicals that can cause damage to the eyes. They think there may be a link between lactose and cataracts, but more study is going to be needed to determine if that's really the case. Looking at the nursing process, all clients may benefit from client teaching regarding risk factors and preventative measures, which we've already kind of talked about. For the client who has developed cataracts, the nursing process is going to be geared towards both treatment and prevention of injury. In the assessment process, looking at health assessment, you want to look at the effect of vision changes on lifestyle and activities, such as their ability to read, watch television, participate in work and recreational activities. You also want to ask them about their history of smoking, diabetes, prescription drug use. All of those are associated with the increased risk of cataracts. In the physical examination, looking at their general health, you also want to assess visual acuity using their corrective lens and a Snellen chart. You also want to evaluate each eye. They do them individually and together. You want to assess the presence of the red reflex. Look to see if they have a cloudy gray or white pupil, and that would be indicative of a cataract. These are your NANDA diagnoses. In planning, goals may include that the client will remain free from injury, be able to articulate understanding of surgery and the risk involved, participate in self-care activities to protect eyes from further damage and to maximize their safety, follow self-care instructions following surgery to ensure healing and to maximize benefits of the surgery. All right. With initial diagnosis, teaching is going to focus on the disorder itself, indications for surgery, and vision restoration following cataract removal. So in preventing injury, wearing sunglasses with UVA and UVB protection when they're outdoors, using reading or prescription glasses or contact lenses as necessary, maximizing lighting for reading, cooking, and other indoor activities, and limit or discontinue nighttime driving. A lot of times they have more glare and have more difficulty seeing at night. After surgery, they may have mild or moderate discomfort and some fluid discharge from the eyes. And you would explain that these symptoms usually subside in 1 to 2 days, but if they should persist longer, then they need to call the doctor's office. Most cases, healing is complete in about 7 to 8 weeks. All right, in facilitating informed decision making, you want to explain non-emergent nature of the condition. You want to help the client determine the effects of cataracts on their daily life. This will help them to decide if they need to proceed with surgery or not. You also want to attend to verbalize concerns about the surgery and its outcomes. In teaching principles of self-care, you want to assess for factors that interfere with self-care postoperatively. Some of your chronic conditions may affect the ability to administer eye drops, like if they have arthritis. You also want to assess for other healthcare needs, like if they need to do insulin injections at home because they're diabetic, that may be impacted by their vision changes in the early postoperative period. So if this is the case, they may need home health or nursing care postoperatively for a little bit. All right, when you're looking at preoperative and postoperative teaching, limitations, this could be teaching them that they need to avoid reading, lifting, bending to pick up objects, strenuous activity, sleeping on the operative side, and all of this is postoperatively, and a lot of times the amount of time may be individualized according to the patient. You also want to express the importance of not disturbing the eye dressings, prescribed medications and their side effects, teaching them about that, and teaching them about the importance of their follow-up appointments. Teach them about manifestations of complications. That could be eye pain, decreased visual acuity, or other changes in vision, headache, nausea, itching, and redness of the affected eye. Administer eye drops and application of the patch or shield. Some will use a shield and some will use a patch, and they just take it off long enough to put the eye drops in and they put it right back on. You also want to teach them about care, insertion, and removal of contact lenses as appropriate. Also, visual changes associated with glasses. Usually this is going to be thick lens glasses as appropriate as well. Promoting wellness. Care of the patient in the community revolves around prevention, so like wearing eye protection during hazardous activity, wearing sunglasses with UVA and UVB protection, the link between smoking and cataracts. So your clients that have diabetes, history of visual problems, and use of frequent corticosteroids are going to be recommended to have an ophthalmic treatment or assessment at least every 2 years. Smoking cessation programs for your smokers, appropriate eye protection for when they're dealing with tools or in the sunshine. So some of that may be like welders to make sure that they're not having any tiny shards of metal go into their eyes. Eye and vision assessment should be done at each visit for clients 65 and older. You also want to inquire about problems with vision and date of their last appointment with the ophthalmologist or optometrist. In evaluation, expected outcomes may include that they remain free from injury, they make informed decisions regarding cataract surgery, verbalize concerns about home care, they verbalize appropriate home care activities, and they demonstrate correct medication administration. So this is the end of the cataract component, and as always, if you have questions, please let me know and I will try to help clarify.